Hi everyone, welcome to a new episode of Reframe Your Health with myself and Dr. Labib alongside me. Today's episode will be about PCOS. We've received a lot of requests, but at the top of them was PCOS, and we thought that what better topic to discuss on our podcast than PCOS and approach it from a functional medicine standpoint.
Yeah, absolutely, Youssef. PCOS is a very common disorder, or you want to call it a disease, or they call it syndrome. And I think we're going to try to dissect it down and explain the causes and how to approach it from the functional standpoint. And because it's a disease that affects women in their reproductive age group, and it can have long-term consequences. So first, let's start with what is PCOS? If you want to define PCOS, what is it?
So probably a lot of people that know me know that this is one of my favorite topics to talk about. So I always like to put the distinction between the disease and syndrome. And PCOS is a syndrome rather than a disease. And the difference is that when there's a syndrome, you have a bunch of symptoms, and different people can have different types of symptoms, and even the same person can have different types of symptoms. But really the hallmark of PCOS is irregular cycles and high androgens. And cycles can be too frequent, too long, coming more than they should be, or way less than they should be with PCOS. And androgens, which are hormones present in women to much lesser extent than men, in PCOS women are significantly more elevated.
So these are basically the why women have the symptoms. But what makes those hormones imbalanced?
Correct. So
and I think this is the problem where a lot of physicians or ourselves in the past, we just used to treat those.
Correct.
Try to fix those hormones and not fix the root cause of these hormones.
So really there are two main problems with PCOS. First, the high androgens, and two, the insulin resistance. Now, obviously there is a genetic component to it. There's a genetic cost to it. But what has made it more prevalent, more common, more of a problem is what we've been exposed to, is our lifestyle, what's going on in the environment, what people have been eating, and what has changed these genetic factors, brought them out to become way more evident.
So it's one of those chronic diseases.
Correct.
Yes.
Obviously, we said there's a genetic component to it, but environmental factors like nutritional habits, bad sleeping habits, toxins, etc., are these the things that are causing it to become more common and more.
Youssef, I noticed also, like if you compare polycystic ovarian syndrome, like women that have this disorder in the Middle East, for example, Mediterranean area, they're a little bit, their phenotype or the way they present looks maybe a little bit different than in other geographic areas, probably because, like you said, the epigenetics and how we live, and maybe also the genes are a little bit different. But so it's a combination of things.
Correct.
So now you're saying, we are genetically predisposed, but we are living, unhealthy life, or the way we are living. So what are these things that we can modify in order to improve the symptoms, or at least maybe control or maybe eliminate the disorder?
Correct. So, well, from a root cause perspective, apart from insulin resistance, which is a very big factor here, there is adrenal issues, which are the two glands that are above the kidneys. There is issues with gut dysbiosis, environmental toxins, and one very important factor which I recently started paying a lot more attention to it is the dysregulation in the sleep wake-up cycle, which we call circadian rhythms. It's something extremely important because your hormones, they're not always anybody's hormones. They're not constantly being produced. They actually fluctuate throughout the day and throughout the night, and they follow a certain rhythm.
Okay.
And uniquely, the rhythm of sunrise, sunset, cyclic rhythms, moon rhythms, all these rhythms, they affect how hormones are produced. So that's a very important root cause that, unfortunately, in our modern world, we live in a world that's full of technology, full of lights, full of distractions. We forget to pay attention.
Shut down. Shut
Correct.
down when it's the right time to shut down.
We forget to respect the circadian rhythms. I mean, we're at fault, you're at fault, everybody's at fault. How many times you wake up in the middle of the night to use the bathroom and you see yourself opening your phone, and then all of a sudden you
Every night.
Exactly.
Yeah, unfortunately.
So that's what I try to educate all my patients, is that respect the circadian rhythms.
So you talked about insulin resistance. So where does this come from? Why do we have insulin resistance? So insulin is one of the hormones, right, secreted by the pancreas that controls our glucose. And why, and what's insulin resistance, to start with, just to like explain it, and why is it a reason or is it a consequence of PCOS?
Insulin, as you mentioned, is a hormone that helps with regulating sugar. Mm-hmm. And insulin resistance is when the body stops responding properly to insulin. It's a hormone that's trying to deliver a message, but when it knocks on the door, really nobody's listening, nobody's answering. So it tries to knock harder. The body tries to make more insulin. Is it the cause? Is it the consequence? I think it's a bidirectional road, as they say. When there is insulin resistance, there is more production of high androgens, but also when there is insulin resistance, there's more fat storage in places where they shouldn't be.
Exactly.
Okay, so when we have insulin resistance, the fat tends to be stored around our organs and around the liver, around the intestines, in the midsection here, and this causes more insulin resistance, and you end up having a vicious cycle where you have more fat, more insulin resistance, and worsening.
So when the insulin, goes high up, the glucose is lowered. But let's say your glucose level was like 150, and then now you increase your insulin to lower your glucose. Now your glucose drops to 100. This drop in glucose goes to your fat.
Correct.
This is where it's stored. And then fat actually produces estrogen, which makes the cycles abnormal and can lead to what we call hyperplasia in the endometrium, which later on can maybe cause endometrial cancer or put these people at risk of endometrial cancer. So it is a pretty vicious cycle.
It is a cycle.
But how can we, where should we attack it from?
Well, you should attack it from everywhere.
Good.
Okay, now obviously the one of the main things that I wanted to bring up today is the challenges in diagnosing and looking for the potential long-term problems.
So before you talk about the diagnosis, one of the very common questions we ask, I went to my physician, they did an ultrasound, my ovaries are not polycystic, I don't have polycystic ovaries. So why are the ovaries polycystic in certain people? I know it's not part of the criteria, so you don't have to have polycystic ovary, shape-wise, but you can still have this metabolic problem.
Correct.
But why do some women have the polycystic ovaries, and what causes it, basically?
Well, there's different phenotypes, meaning that there's different way of people presenting with PCOS. Some women don't have the polycystic ovaries, and
don't have period problems either. They have, the other metabolic. So
correct.
Again,
so it's a spectrum.
So
it's a syndrome.
So it's not a gynecological problem only.
Exactly.
This is very important.
It's not a gynecologic problem. The name by itself is a bit misleading because people think that it's a problem in the ovaries, but it's actually not. It's actually an endocrine problem. It's a problem in the organs that produce and respond to hormones, and one of them is the ovaries.
Correct. Yeah, that's why, as gynecologists, we see a lot of polycystic ovary, patients, but some of these women end up with endocrinologists.
Correct.
And I think, like we're talking, they have to be, managed by endocrinologists, gynecologists, functional medicine doctor, nutritionist, and I think at the end, it's themselves. They have to be the ones taking care of their body in order to fix the problem.
Right. They have to be really taken care of by somebody who really understands the problem and tries to actually scratch the surface to dig under and see what other issues are wrong or dysregulated to fix it.
Okay, so now you said some women don't have period problem, but they have, they're overweight and they have the insulin resistance. So what's the problem with that? What's the long-term complications? If they want to get pregnant in the future, their long-term, heart health, what should we do? And what should we tell these women?
So because it's a multi-organ problem, it's, again, we mentioned earlier, it's not a problem in the ovaries. It can lead to a bunch of complications. If they have fertility issues, infertility is a problem. But once that fertility problem is solved, pregnancy complications can come up. Women who get pregnant and have PCOS can have diabetes of pregnancy, hypertension of pregnancy, preterm labor, pregnancy loss, even early pregnancy loss like miscarriage and cervical incompetence. Now, aside from fertility...
But the good news, if the PCOS is under control, then these complications that you said will be much lower or even almost eliminated.
That is true.
Yeah.
Now, health-wise, that's why I tell people you should never ignore it, because health-wise, there is long-term complications. Heart disease, cardiovascular disease in general, fatty liver, kidney disease, mood disorders, anxiety, lack of sleep, depression, risk of cancer in the uterus, which we call endometrial hyperplasia, risk of dementia. A lot of times we ignore these things and we just say, okay, this is let's regulate your cycle, and you have some excess hair, get laser or pluck it. Or the problem is beyond that. The problem affects the woman years and years down the line, and that's why it should never be ignored.
So the other thing, I used to see a lot in practice, and I used to do it, in certain women that had, hirsutism or extra hair, irregular periods, putting them on birth control pills.
Right.
Okay. So what are your thoughts on birth control pills? Should they be used in these situations for a short period of time or not at all? Or what do you think?
The answer is really, it depends. But birth controls are not treating the syndrome.
Okay.
Birth control in the setting of PCOS should be given if somebody wants to avoid pregnancy and wants to be on birth control pills.
So for contraceptive purposes?
If they don't want any other method. Number two, if they haven't had a period in a long time and you want to protect the endometrium and prevent hyperplasia, you can use it for a short period of time while you're working on fixing the problem from inside out.
Okay, so let's start by fixing the problem inside out. So where do you start? If you have, a young 22-year-old who, has the syndrome, basically, you diagnose her with the syndrome. So where do you start?
So I start by having a lengthy coaching session with them. We start talking about resetting everything in their life, resetting their sleep-wake cycle, resetting their nutritional habits, resetting their exercise habits, and putting them on a supplement regimen. And then we talk about short-term goals and long-term goals with respect to reproduction and with respect to fertility.
So how do you fix somebody's sleep? What are some tips that we can give women about the sleep? Because, like you said, our life is distracting, there's a social life, media, all of this is... So where do you start? And
so I always start step by step. I always tell them to, when they wake up in the morning, try to wake up early, open up the blinds, get a strong dose of fresh, bright sunlight, and let your brain...
Not from the cell phone.
Not from the cell phone.
Yeah, natural light.
Not natural, if possible, if you have access to natural light. And then the same thing in the evening. In the evening, look at the sunset. You're getting cues to your brain that it's time to sleep. And then put your phone on night shift. Try to not use your phone in the evening. In the bedroom, obviously, no phones, no TV, no bright lights. Little things, but obviously there are supplements and medications that can help with sleep. Okay. Sometimes if the cortisol level is too much, there's a lot of chronic stress going on in their life and they're unable to sleep. We use medications or supplements like melatonin, magnesium to help them regulate their sleep. They tweaked in a certain way so that they can get adequate sleep and wake up fresh.
So that's for sleep. For exercise, let's say, what are the the best because this is always controversial. What's the best type of exercise to do for women with estrogen dominance or PCOS?
So from the first thing people will hear me say is just move. Any kind of exercise, just move. Get out of.
Especially if you didn't move before, then yeah.
Any type of exercise is good. Obviously, you have to respect your energy levels. There are certain time periods of the month, if they're having regular cycles, there are certain periods of month whereby they're not gonna feel energetic, and they're okay with doing light exercise, yoga, stretching, Pilates, and swimming. And then in phases of the cycle where they have more energy, then they can weightlifts. I try my best to encourage them to do resistance exercise because that builds muscle, and when you build muscle, you improve insulin resistance and longevity.
Perfect. So the diet, I know diet is a huge topic, but just like outlines of tips for a best, let's say, diet. I know there's not a perfect diet for everyone.
Yeah.
But what are some highlights that I know people keep hearing on social media about Mediterranean diet, and so. But what are some quick tips that you can give them?
So the first tip, I never mentioned the word diet to people. I like to call it nutrition. Let's focus on fixing your nutrition. Okay, because nutrition is fuel, and you need it to produce hormones. You need it to have red blood. You need it for everything, daily functions. So. And there's no diet that fits everybody. Okay, so I try to encourage them to do what I call it as a Mediterranean-inspired diet. And what's that? That's full of vegetables, fruits, whole grains, legumes, eggs,
good
chicken,
fats, yeah,
and healthy fats. Obviously, we're talking about nuts and seeds and olive oil.
Olive oil.
It's our favorite. And red meat, although I like to keep it to about 10 to 20% of their total consumption. I don't want people to start measuring, but obviously gauge it, eat it once or twice a week, preferably grass-fed if they're able to get it. But also the timing of
eating.
Respect circadian rhythms. Our ancestors did not eat at midnight. They did not have a fridge that they just opened it and brought a pint of ice cream and they ate. We've all done it, but it should not be the norm. Respect that eating during the day, which I like to call it timed eating. I don't like to say intermittent fasting and have people go on a specific diet, because I believe in sustainability. And you want something sustainable. Exactly. So I tell them, respect the sunrise, sunset, eat your dinner by sunset. And then 2 or 3 days out of the week, delay your breakfast a little bit. That would count as intermittent fasting.
Yeah, and then you have to kind of tailor your diet to your lifestyle.
Correct.
And your work and your job. Some people work at night. So, you have to kind of fix things.
Now,
so speaking of food, what about the gut? Because you mentioned something about the gut. So should you test, do the microbiome testing? Is it a must to do that? And
it's not a must. Obviously, if somebody has gut issues, if somebody has clear signs of leaky gut, chronic inflammation, celiac, aside from eliminating the obvious things, you can do GI mapping, testing for gut dysbiosis. It's not a must, but it's one of the advanced additional tests that we can do. But in any case, if people start respecting the eating during the day, avoiding eating, that's the first step in healing the gut.
Excellent. So what are some, let's say, blood testing, or let's name maybe the top 5 blood tests that someone at the age of 25 or 30 with PCOS should have, for long-term health or...
Labib, I used to believe that 5 or 6 top, but I think the panel should be complete. The panel should be done. Everybody should get an ultrasound, and they should have a full hormonal panel, including a thyroid, androgen check, cortisol check, morning insulin, fasting insulin, and obviously the regular complete blood count, liver check, and kidney check. not every now and then, very commonly you would see somebody with PCOS with elevated liver enzymes.
Yeah.
Without even getting an ultrasound, you know that there's an element of fatty liver in there.
Yeah.
In some patients, I get an endometrial biopsy if they haven't had a cycle in 4 or 5 months, and there's a concern of having thickened endometrium. So I always get the full panel. And then if I did all that and I started the changes and I see that there's not a whole lot of improvement, then we can go to advanced testing, and we do testing like the Dutch test,
Right.
the dry urine testing for comprehensive hormones. And this tells you, really, it gives you a whole idea of what's going on. When you do the blood work and you do the Dutch, you will have a great idea of what's going on with all the hormones, how the hormones are being eliminated from the estrogens, progestins, and androgens, as well as cortisol.
Yeah, so like you said, the Dutch test is a new functional test, and it also gives you you can do the cortisol levels throughout the day, and it will help us know what's happening with your rhythm.
Yeah.
Because cortisol sometimes goes along with the rhythm. Okay, so the Dutch test is one of the new tests, and I think it's pretty helpful. Any other functional health? Functional testing that you would recommend other than let's say the microbiome and the Dutch test? Are there any, because you hear a lot about now these new genetic testing that would help you with your nutrition, like the nutrigenomics, which will help us know which diets will suit you more. Again, these are very advanced testing, and I'm sure people have heard of them. They might be helpful in certain situations, but it's not a test that should be done in everyone. At the end, I think the less we complicate things, the better. Of course, if the picture doesn't go along with PCOS, there's something missing, then yes, we can dig deeper. But in general, lifestyle changes, will take off quite a bit of the symptoms.
Right.
Supplementation. You mentioned supplements or treatments. What's a nice, combination of things that you would recommend?
So the number one supplement I have all my PCOS patients on is myo-inositol. I prefer the powder form, and everybody gets 2 grams twice a day.
What is it and what does it do?
So myo-inositol is a naturally occurring sugar. It's a natural supplement that helps with insulin resistance.
Okay.
It helps with regulating the cycles, and there's some evidence that it can help with the quality of the eggs. So it's helpful for somebody who's young, PCOS, trying to conceive.
Okay.
There's also some evidence that it can help even prevent diabetes in pregnancy, and really minimal, if any, side effects from the supplement.
Any other supplements?
The second supplement that I have my patients on is vitamin D, extremely important for hormone production, probiotics and prebiotics. And then we go into the antioxidants. I do a short course of NAC and I add turmeric. This is as a start for everybody because a lot of patients have chronic stress, chronic inflammation. They benefit from antioxidants to kind of calm down the inflammation. Yeah. There are other supplements, natural herbal things that we can use, especially in somebody who has high androgens. There's spearmint tea that's been shown to reduce the androgens. Obviously, we have some medications to reduce the androgens, something like spironolactone, which I use frequently. So it's a combination of things. Okay. But obviously, the natural things that you don't have to worry about, the side effects are preferred for long-term use.
Yeah, and I know some practitioners also who would also support the liver, because the liver detoxifies a lot of the hormones. So sometimes the liver gets tired, and we need to support the liver to let the estrogen cycle not get back into our system and get metabolized correctly. And this is where the Dutch test will let us know how the estrogen is getting metabolized. So liver support, like you said, antioxidants, myo-inositol, of course, in addition to the exercise and the nutrition and the circadian rhythm and everything. So it's a big combination of things that slowly you can incorporate into your life, and I think it's always better to incorporate those into your life than incorporate your life into those. Okay,
True.
so but I think baby steps are important, and I think
They work together, and most importantly is that they don't work overnight, because you're really healing things from inside out.
Exactly.
I always tell them to be patient, allow themselves 3 to 4 months to start seeing something. Always being careful with how often they're bleeding, if they're not bleeding that much, so that we can give them some progesterone in the meantime to protect their endometrium.
Excellent. I think, we covered a lot of the questions we got about PCOS. I'm sure there's going to be plenty more.
Yeah.
It's going to be difficult, to cover them in one episode. Of course, hopefully in the future, if we get, a big list of questions related to PCOS, we will do part 2 or PCOS to be continued. But again, we'll be waiting for more questions, because it's a very common disorder affecting a lot of women, short-term, long-term. So it's
important that you mentioned that it's very common. In the literature, in the books, we read that it affects 10% of women, but it actually probably affects more.
Yes.
And as our lifestyle continues to be like this, we're probably going to see more and more people.
Exactly.
So people have to pay attention. I hope that anybody who's suffering from irregular cycles, acne, hair growth, difficulty losing weight,
having miscarriages, recurrent miscarriages.
Correct.
Yeah.
Pay attention to these signs. Seek help, get checked, and if the provider kind of brushes it off that it could be no, it's not PCOS. Well, it could be.
It could be.
You can have PCOS with virtually very minimal symptoms, and the long-term problems are gonna be there.
Yeah. I know people imagine PCOS someone overweight with abnormal hair growth and irregular periods, and no, you don't have to have. You can be lean but have the insulin resistance. So I hope this podcast is like an eye opener to women that are suffering from these conditions, and not to ignore them, not just put a band-aid and take the birth control pill. Try to see why it's happening. So I hope we were able to open the eyes on this condition, and of course we're ready for any question, and hopefully we can see them in the next episode, which we still haven't decided what it's going to be. Depends on the questions we'll be getting.
So as you said, Labib, there's a lot more to talk about this syndrome, and a lot of new things that are coming out, and luckily we are able to have this knowledge at this point to be able to fix this issue. And then as a final closing thing, I want to tell patients to don't ignore their symptoms, seek help, question. Don't settle for just taking a pill and come back when you want to get pregnant.
So be curious.
Question, be curious.
Exactly.
Fix from inside out, and it takes time to fix the problem.
So be patient, and hopefully we'll see you back in the next episode about PCOS updates. Because you're saying there might be some new things coming out. So hopefully updates, more questions, and hope everybody have a great evening and or day wherever you are. And we'll see you next time in a next episode of Reframe Your Health podcast.
Thank you.